If you're over 60 and still forcing yourself to walk every day, this may be quietly damaging your body more than helping it. You were told walking is the safest exercise, the simplest, the doctor-approved choice for seniors. And yes, walking can be helpful. But here's the uncomfortable truth. Most people over 60 are never told. Walking alone is often not enough anymore. And in some cases, it may actually be speeding up joint pain, balance loss, and muscle weakness without you realizing it. If your knees ache after walks, if your hips feel stiff when you stand up, if your lower back tightens or your feet feel heavy, that's not just aging. That's your body asking for a different kind of movement. As we pass 60, our muscles shrink faster. Our balance systems weaken. Our joints lose shock absorption. Walking only moves the body in one direction, at one speed, using the same muscles over and over. It doesn't train balance, it doesn't protect joints, and it doesn't stop age-related muscle loss. That's why so many active seniors still struggle with falls, still feel unstable on stairs, still lose strength year after year, even though they walk every day. This isn't your fault. Most fitness advice was designed for younger bodies, not for joints that have carried decades of work, not for muscles that need protection, not punishment. Surgeons and physical therapy specialists see this every day. They see seniors who walked faithfully, but never trained strength, never trained balance, never trained joint support. And now, they're paying the price. The good news? You do not need to stop moving, and you do not need intense workouts. You simply need smarter movement. There are specific exercises, gentle, controlled, surgeon-approved, that protect your knees, hips, and spine better than walking ever could. They strengthen the muscles that keep you upright. They reduce joint pressure instead of increasing it. They improve circulation without pounding your joints. And when done correctly, they can make daily walking feel easier again, not harder. In the next part, I'll explain why walking stops working after 60, the biggest mistakes well-meaning seniors make, and how a small shift in movement can dramatically change how your body feels. Because once you understand what your body truly needs now, you'll never look at walking the same way again. Let's start by clearing something up. Walking is not bad, it's just incomplete. After 60, your body changes in very specific ways, and walking does not address most of them. First, muscle loss accelerates with age. This is called age-related muscle decline, and it begins quietly. You may not notice it at first, but each year after 60, unused muscles grow weaker and smaller. Walking mainly uses the same leg muscles again and again. It barely activates your glutes, core, hips, or upper body. And it does almost nothing for side-to-side stability. That's why many seniors walk daily, yet still feel unsteady when turning, still struggle rising from chairs, still feel weak climbing stairs. Second, balance systems weaken if they are not trained. Balance is not just about the legs. It involves the feet, hips, core, eyes, and inner ear working together. Walking on flat ground trains none of this. It doesn't challenge balance. It doesn't teach your body how to recover from a misstep. It doesn't prepare you for uneven surfaces or sudden movements. That's why falls often happen to people who walk all the time. Third, joint stress increases with repetitive motion. Every step places force through your knees, hips, ankles, and lower back. When muscles are weak, joints absorb more shock. Over time, that repetitive stress adds up. That's when walking begins to feel harder instead of easier. Here's the biggest mistake seniors make. They think more walking equals more health. So they push through pain. They ignore stiffness. They believe soreness means progress. But after 60, Pain is not a sign of improvement. It's a signal to change approach. Another common mistake is avoiding strength exercises out of fear. Many seniors were taught that strength training is dangerous, that it's only for young people, that it will damage joints. In reality, gentle strength work is one of the safest things you can do when done correctly. Strong muscles protect joints. Strong hips protect knees. Strong cores protect backs. Surgeons know this. Physical therapists know this. That's why post-surgery recovery always includes controlled strengthening, not endless walking. Another mistake is moving only forward. Life doesn't happen in straight lines. You twist, you turn, you reach, you step sideways. If your exercise only moves forward, your body becomes fragile in every other direction. And finally, many seniors exercise without rest awareness. Walking every day without recovery can quietly wear the body down. Your tissues need time to rebuild. Your joints need variety. Your nervous system needs balance challenges, not repetition. So what does your body actually need now? It needs exercises that strengthen without joint strain, train balance safely, support knees, hips, and spine, improve circulation without pounding, mimic real-life movement. The right exercises don't exhaust you. They make daily movement feel lighter, more confident, more controlled. In the next part, I'll walk you through surgeon-approved movements that meet these exact needs. They're simple, they're realistic, and they're designed specifically for adults over 60. These are not workouts. They are daily habits your body understands and responds to. These movements are not workouts. They are daily body maintenance habits. They are used by surgeons, physical therapists, and longevity specialists because they protect joints while restoring strength, balance, and confidence. Do them slowly. Breathe naturally. Stop before pain. Even 5 to 10 minutes a day is enough. Exercise 1. Supported sit to stand. The most important strength move after 60. C. This single movement trains your legs, hips, and core the way daily life actually demands. Sit on a sturdy chair. Feet flat on the floor. Hands resting lightly on the armrests or thighs. Lean forward slightly. Press through your heels. Stand up slowly. Pause for one breath. Then lower yourself back down with control. Do not drop. Do not rush. Start with 5 repetitions. Work up to 10. This strengthens the muscles that protect your knees. It improves balance. It directly reduces fall risk. If walking is becoming harder, this exercise rebuilds the strength walking cannot. Exercise 2. Heel-to-toe balance walk, nervous system training. This is not about speed. It's about control. Stand near a counter or wall for support. Place one foot directly in front of the other, heel touching toe. Pause. Shift your weight slowly. Then step forward with the other foot. Take 5 to 10 slow steps. If this feels difficult, that's a good sign. It means your balance system is waking up. This retrains your brain and body to communicate again. Walking on flat ground does not do this. Improved balance means fewer falls and more confidence moving through your day. Exercise 3. Standing hip abduction, knee and back protection. Weak hips cause knee pain. They also strain the lower back. Stand holding a chair. Keep your body upright. Slowly move one leg out to the side, only as far as comfortable. Pause briefly. Return slowly. Do 8 repetitions per side. This strengthens the side hip muscles that stabilize your pelvis. When hips are strong, knees track properly. Walking alone does not activate these muscles. Exercise 4. Seated marches, joint-friendly circulation boost. Sit tall in a chair. Lift one knee gently. Lower it. Then lift the other. Move slowly and smoothly. Do this for 30 to 60 seconds. This improves circulation. It activates hip flexors. It supports lower back health. It delivers many of the heart benefits of walking, without joint impact. Perfect for days when walking feels difficult. Exercise 5. Wall push-ups, upper body and core support. Upper body strength matters more than most seniors realize. Stand facing a wall. Hands on the wall at chest height. Bend your elbows slowly. Bring your chest closer to the wall. Push back gently. Do 8 to 12 repetitions. This strengthens arms, shoulders, and core. Strong arms help prevent falls. Strong cores support posture and breathing. Walking ignores the upper body entirely. How to use these exercises? You do not need to do all 5 every day. Rotate them, mix 2 or 3 per session. The goal is consistency, not intensity. If walking feels good, you can still walk. But now, your body is supported. These exercises fill the gaps walking leaves behind. In the final part, I'll explain how it's never too late to start, why small daily movement changes compound powerfully, and how to build confidence in your body again. If you've made it this far, there's something important you should hear. Your body is not broken. It's not failing you. It's responding exactly the way a 60-plus body responds when it isn't given the right kind of movement. And that means it can still respond positively. Starting today. Many seniors believe they missed their chance. That strength loss is permanent. That balance decline cannot be reversed. That simply isn't true. The human body is remarkably adaptable at any age. It just adapts more slowly and needs clearer signals. When you give your body controlled strength, when you challenge balance safely, when you move with intention instead of repetition, your muscles wake up, your joints feel supported instead of stressed, your confidence quietly returns, not overnight, but steadily, and that's how real, lasting health works after 60. You don't need to push harder. You need to move smarter. 5 minutes a day can matter. 10 minutes can change how you feel within weeks. Standing up becomes easier. Stairs feel safer. Walking feels lighter again. Most importantly, fear begins to fade. Fear of falling. Fear of pain. Fear of becoming dependent. These exercises are not about fitness. They are about independence. They help you keep doing the things you love. Getting out of a chair without effort. Carrying groceries confidently. Walking outdoors without hesitation. And remember this, rest days are not weakness. Slow movement is not failure. Listening to your body is wisdom. If a movement feels uncomfortable, reduce the range. If a day feels heavy, do less. Consistency beats intensity every time. You don't need special equipment. You don't need a gym. You don't need to compare yourself to anyone else. Your progress is measured in comfort, confidence, and control. If you've been walking faithfully for years, you didn't waste your time. You built a foundation. Now, you're simply upgrading the structure by adding balance, by adding strength, by adding protection. If this message helped you see movement differently, stay with us. There are safer, smarter ways to age strong, and you deserve to know them. Take care of your body. It's carried you this far, and it's still capable of more.